Hello, and welcome back to another episode of the Dental Hygiene Basics podcast. My name is Dana. I am your host. I'm excited to be here. And today we are talking about how to survive dental hygiene midterms. Or if you are a student that's applying to dental hygiene school, you are still going to have midterms as well as you're going through your prerequisites. So honestly, these tips are for anybody, wherever you are on your journey. Let's dive in. Why are we talking about midterms? Because it's that time of year and we have to spend some time getting ready to crush these tests. And I want you to walk into midterms with maybe a different perspective than you have currently, because I think a lot of times we see on our syllabus all of these tests that are coming up and we start to feel kind of overwhelmed and panicky. And we're thinking, how am I going to do all of this, right? How am I going to juggle? How am I going to go from a test in this class and turn around and go straight to a test in another class? If your instructors are able to, they may try and stretch them out a little bit, but oftentimes we're all testing at the same time because it's midterms week and that's what has to happen. The university says this is when you test for midterms. And so sometimes we're a little bit strapped as professors. We have to put, midterms back to back. It's not ideal, but that is the way that it is. And you are in a collegiate setting. And unfortunately, that's just how things roll sometimes. Does that mean that you can't be successful? No, it just means that we have to be prepared, obviously. Preparation powers performance, but we also need to go into this with a slightly different mindset. Okay. The first thing I want you to recognize is that midterms are not meant to prove you don't belong. It's not meant to weed out the herd, right? Really, midterms are an opportunity to see where you are in the middle of your class. Have you met the goals and objectives that you were supposed to achieve up until this point? When we think about taking a test, I want you to recognize that whenever you read the textbook, at the beginning of the textbook, the first thing in the chapter, it shows objectives. The objectives tell you what you are learning from that chapter. Okay. Most instructors, if they've been around the block for a while, at the beginning of their PowerPoints or their lessons for the day, they will also have objectives. And the objectives tell you what you're supposed to learn in that session. From there, you are supposed to be tested on those objectives. So if you do your job right and you pay attention in class and you study and you do all the homework assignments and all that fun stuff, then you should meet the objectives. And the objectives are being tested on your exam, right? So that's just a little kind of background information on how teaching works. We're really supposed to have a plan going into the lesson of what we're going to cover and what the students are supposed to take out of that lesson. And how do we know if our point got across? It's how they perform on tests, like the midterms. Okay. Now, there's two things that go hand in hand. One is the instructor. How well of a job did the instructor do? If most of the class is passing, okay, the instructor's on the right track. If most of the class is failing, I think that we should turn around and look at the instructor. With that being said, teaching in school, I think of it like we're teammates, right? I may be your teacher, but you are the student, and we both have to bring a certain level to the playing field in order to achieve the same result. We both want the same thing. Whenever I am teaching because I want you to pass that class or that course or whatever it is that I'm teaching. But you have to show up to the table too, right? Maybe you want to pass it, but you have to put the work in. So we both have the same common goal. And I think a lot of times students forget that and they start to think the teacher is the enemy, right? But we have the same goal. So why would we be your enemy, right? Okay, so with that being said, remember, we're just here to test your progress halfway through the course. We need to see where you are standing. This is an opportunity for your educators to see how you're performing and do we need to pivot and make changes. But I think a lot of times where it goes wrong is the instructor is thinking that we're like, okay, we see this subject did not make sense or this topic did not make sense. Let's come back to it, review it again, figure it out. But I think the students stop at the midterm grade and they maybe think, well, I didn't perform as well as I could have, or I missed these questions, but your brain is already thinking on to the next. And there is something that we all should be doing after every exam, after every assignment. It's just taking a few minutes to self-reflect, okay? And that self-reflection really is going to tell you where you are on this path. Are you on the right track? So keep in mind that every test, every quiz, every assignment is feedback that you're getting on how you're performing, not how someone views your performance. It's literally how you are performing. And if your scores aren't reflecting maybe how hard you're studying, Or if you're struggling and your scores are showing that, then we need to reflect on that and we need to start getting help. Okay. You want to get this figured out ideally before midterms, but if it's at midterms, no worries. There is time to turn it around and get things figured out before the end of the semester. Remember, everything in dental hygiene school builds on each other. I was actually just doing a live board review a few weeks ago with student RDH, and the way I kind of constructed my lessons was showing the big picture, right? How does each subject connect with another subject? And I don't think that we realize this until maybe way later in our education, that there are links between every single subject. When you are studying head neck anatomy, you also could be studying radiology, right? Because where do we see the bones of the skull? We see them in the x-ray. Where do we see the sinuses? We see them in the x-ray, right? You're learning all of these things in head neck anatomy because you're applying them to a real patient and you're applying them to x-rays. So seeing the big picture is really important because remember, all of these concepts are going to flow together. And if you have a strong foundation in each subject, you're going to have a better overall picture of how dental hygiene works. And it's also going to help once you get to your board exams as well. All right. So the next thing, what are midterms actually testing? I mentioned they're testing to see where you are up until that point. When you are studying, look at those objectives, look in the textbook, see what it is that you are supposed to take away from each of these chapters, right? Study the big ticket items. The other thing, listen when you are in class, okay? If you do not pay attention in class, you are doing yourself a huge disservice. I know it can be hard. I'm actually speaking from experience. I used to not, well, that's not true. I would listen in class, but I would distract myself in class as well. Back in the day, I was always on Facebook or answering emails, things like that. What ended up happening? I had to go teach myself that material outside of class, whereas I could have at least listened and engaged a little bit more and tried to pay attention a little bit more. And I know it's hard in these long lecture periods, but that would have been my first exposure. Even if I would have just listened and caught the moments that the instructor said things like, this is important, or their voice kind of elevates, or they have something in red on the slide, I would have put a little bit more emphasis into basically starting to understand my teacher's habits and understand what they think is important. Once you get the hang of understanding your professors, it gets a lot easier to perform well on their tests. Okay. So, first things first, pay attention in class, get to know, understand your professors, and take notes, right? As you're taking notes, you don't have to write every single word they say, but try and connect some of those dots, notice big ticket patterns, right? It's challenging, but the more you do it and the more you start to see what shows up on the exam or what's showing up in the homework, those things usually show up on the exam. I was on TikTok the other day and I saw a video that Shelby RDH posted. She's incredible. If you're not following her already, she's been on the podcast, so you can listen to her episode as well. But she was talking to a school and talking about study strategies. And she mentioned that a lot of her quiz questions came directly from the textbook. But where did they come from? The little titles underneath the pictures. And I thought that was so brilliant because the pictures and these little like boxes off to the side, what are they? They are really showing you the big ticket items, right? The big picture items that we need to know. So as you're studying, look at the pictures, right? And see if you can figure out what's going on, read the little subtitles underneath, and see if that helps improve your score a little bit. Okay, the other thing I want to mention when you're studying for midterms is to look for patterns. An example of a pattern would be, when you're learning a medication, what are the side effects that go with that medication? What are the oral side effects specifically, right? So for example, calcium channel blockers, the main oral side effect is gingival overgrowth. But there are other medications like warfarin, the main side effect is gingival bleeding. That's a pattern, and they are two very distinct patterns, right? That can help you in many, many ways on the exam. One, if you come across those drugs on the exam and it says, which of these drugs has gingival bleeding as an oral side effect, you're going to know the pattern associated with those drugs, and you're going to be able to rule them out based off of the patterns that you know. So be on the lookout for patterns in dental hygiene school. Honestly, almost everything has a pattern. The other thing is, if you are taking a midterm and you are required to know charts, things like that, like blood pressure guidelines, ASA guidelines, staging and grading guidelines, right? These aren't hard. They are just charts that have to be memorized. And this is where using active recall is so important when you're studying. I hear this time and time again as I'm working with my students and I'm asking them, okay, how are you studying? And they're like, well, I just read my notes or I highlight, right? When you highlight and you read, you are just being exposed to it. Exposure is a good thing the first time that you see it, right? You should really expose yourself to something like before you go into class, okay? Then you're exposed to it again when you're sitting in class and you're engaging with the professor, asking questions, taking notes, realizing what you know and you don't know. But once you get those few initial exposures, if you just keep exposing yourself to it again and again and again and again, your brain starts to not really engage with the material and it doesn't view it as a challenge. And you will end up getting to the point where you recognize material on the exam, but you don't know the material, meaning you will be like, I know I saw this somewhere, but you won't actually be able to answer the question. How do we get over that hurdle? What we have to do is we have to actually challenge our brain. Your brain loves to be challenged. This is where active recall comes in. So instead of rereading your notes for the thousandth time, take your notes. You could probably just slide them into Chat GPT if you typed them and say create a fill in the blank worksheet, right? Take out the key words out of each note like section that I wrote, and then you go back in and you practice filling it in, right? So you're challenging your memory. Flashcards are another way you can challenge your memory. Just be mindful with flashcards. If you spend, 2 hours writing all the flashcards and you exhaust yourself to the point where you don't even want to look at them, right? That's not going to do you any favors. So if you're doing something like flashcards, if you're creating study quizzes for yourself, fill in the blank exercises, keep it small and work on small chunks at a time. It's better to do a little bit every day than to try and knock it all out at once, like right before your exam. With that being said, I think another place where a lot of students go wrong is they cram, right? They maybe don't pay attention in class. They don't take notes. They don't review their notes right after class. Okay. So my tips are look at the textbook material before class, breeze through it. You don't have to know every tiny detail. Then listen in class. And then right when you leave class, quickly review the material one more time again. Then start spacing out how often you look at it. So maybe you'll look at it again, the day after class, and then maybe 2 days after the class, then 3, then 5, right? You start spacing out how many days you go between looking at the material. Your brain loves that. It helps it to download and absorb. Okay. But I think where a lot of students also go wrong is they stop caring for themselves. I think a lot of dental hygiene students don't care for themselves. And I know that I didn't when I was there as well. But sleep, nutrition, hydration, right? Exercise, these are all things that our brain needs to function better. And a lot of students, I'll just give you an example. I had a student who, struggled and was unsuccessful on one of my exams. And I brought them in. We were, talking about it the next day. I'm like, okay, tell me how you studied. And they're like, I'm studying so hard. I just don't understand why I'm failing. I'm like, okay, tell me how you study. And they're like, well, I really just had a lot going on and I was really stressed out. And so I studied a lot last night. I stayed up so late. Like, I just don't understand how I failed. I'm like, okay, how late did you stay up? They're like 3 a.m. This was an 8 a.m. class. Okay. And I'm like, well, did you sleep at all? And they're like, well, I had a lot of coffee, so I didn't really sleep really well. And the whole time I could see that they're like super jittery. Right. And I just had to sit down and have a conversation. I was like, do you think that the study habits that you have are leading towards your success? And it was really hard for them to accept that they were the problem, that it was not the class, it was not the material, it was not how rigorous the program was. It was the fact that they did not put the effort in earlier, right? Because they were juggling so many different things. Where was the problem? They did not ask for help sooner. They didn't get help with time management strategies, right? So the issues showed up at the midterm, right? So I want you to reflect on your thoughts, like how you're performing, right? Think about your test like an athletic endeavor. If you were going to go out and compete, right, like a football player in a game or something like that, you would be training, you would be drinking water, you'd be exercising, you'd be doing all the things. That's exactly what we need to do when we go to take an exam as well. Put in the effort beforehand, but put in the effort to take care of yourself as well, because that's really important for performance. Beyond that, when you're preparing for big tests like midterms, you have to manage your emotions. We can all probably feel the rise as we see more and more tests coming up on the schedule of the stress and the anxiety. Stress and anxiety is not inherently a bad thing, right? But it can tip to a point where it impacts your ability to perform. You may have had this on an exam where you sit down and you just blank out. You feel so stressed out, right? If you're in that state of panic, we have to get you out of it. So, a couple of things that I recommend: one, if you have scratch paper or if you can have scratch paper, jot some things down. Anything that you remember, you can write, I'm awesome, it doesn't matter. But what we're trying to do is get you out of that level of stress and get you into your higher level of thinking. A great way to start doing this on the daily is to journal, right? Start writing in your journal every single day. Write anything that you're feeling, make it negative. Don't worry about if anybody even sees it, right? Just write it all out, because you're clearing all of that stress and anxiety out of your body. And it's going to be really helpful, because what you're going to start to see is a bigger picture. In my journals, I can see the things that are routinely stressing me out. And then I know I need to go fix those problems. They keep coming up over and over again. I'll give you an example. For the past probably year or so, being overwhelmed, feeling like I'm juggling too much, those have been constant recurring thoughts. And finally, after a year, I recognized, I was like, I have to do less. I'm putting pressure on myself to do more. I have to do less, right? So it can be very eye-opening to start to see the things that you're journaling about every single day. The other thing is, if you truly have really bad test anxiety, you can use certain things to your advantage, like cold water, splashing it on your face, drinking cold water during your exam, taking an ice pack and putting it on your chest. That can all help to calm anxiety. Okay. Just remember a few last little tips here. You don't have to feel 100% confident to pass. I think a lot of times as dental hygiene students, we have this thought that if we aren't 100% confident, that we are not going to be successful, and that creates unnecessary stress on us. We don't need that stress, right? We're already working through a very, very stressful program. But you do need to know enough knowledge to at least feel confident that you will succeed. And, thinking through, you don't have to get a 100, right? But if you do, that's a benefit. I want you somewhere as comfortable as you feel with your grades, but I want you to recognize that the most important thing is that you learn the material. And if you learn the material and you truly know it, meaning you're not just been exposed to it, like I could ask you a question, we could have a conversation about it. That's knowing material, right? You get to that point, that will start to reflect in your exams. You will start to see better scores, and you're going to see on the other end, confidence will continue to grow to where you get to the point where, yes, you may still have test anxiety, you may still be nervous, but you've seen enough times that if I put in this effort, I get this result, right? And you start to see the fruits of your labor. If you're not seeing the fruits of your labor, it means that you need to pivot. You need to change your study style. You need to get help. You need to talk with your professors. Maybe you need to get a tutor, right? So keep that in mind. If you're putting in all this effort and something's not working, you need to figure out where in the chain it's going wrong. It could be that you're not prepared. It could be you're not sleeping well. It could be you're not eating well. It could be that it's just one class, right? We have to figure out what's that big friction point and start to work towards fixing it. Last thing I want you guys to remember is that you have made it this far. You are entirely capable of making it through this program and succeeding, right? You would not be here if you could not do it. You have been given an opportunity for a reason. With that being said, it's in your hands, right? So take the time to self-reflect and figure out where we can do better and where we can fix a mindset change, right? The perspective if we need to, so that you can continue progressing through this program strong. And when you come out, you are as competent as you need to be to pass your exams and move into clinical practice by yourself, right? Because one day you're going to be doing all of your amazing dental hygiene skills on your own, trusted to be alone with a patient, and you want that foundation of knowledge there backing you up, and you want that confidence there backing you up as well. And I cannot tell you how much improving your performance on your exams will help with that. Okay. All right, friends. Thank you so much for listening. Best of luck on your journey, future registered dental hygienist. Have a great day and good luck on midterms.